So an 18-month-old boy is brought to the clinic due to a rash on his face. The patient's mother said that he had a mild cold and a fever a week ago, and on exam, patient only has a rash and is otherwise well appearing. What is a complication of this illness? A. Hydrops fetalis. B. Rheumatic fever. C. Subacute sclerosing panencephalitis. D. Congenital deafness. So I'll let you answer the question and then I'll explain. Okay, so the answer is going to be A. So in this case, this is caused by parvovirus B19, and it causes this illness, which is called erythema infectiosum, otherwise known as fifth disease. So the classic presentation of this is going to be slap cheek appearance. So in this case, they didn't give a picture, but they typically do. They'll give a picture with an infant that has really bright red rash on the cheeks of their face. And so this is pretty classic for parvovirus B19. But then the second part of the question is, what is the complication that this causes? So not only do you have to have the clinical recognition of knowing that this is parvovirus B19, but also realizing what's the complication of this. So one of the complications to having this during pregnancy is hydrops fetalis, and I'll get into that after we talk about parvovirus a little bit more. And so we talked about the classic appearance, but the first thing is, even after the kid gets this virus, there's an incubation period of 1 week, so they typically won't have any symptoms. And then after that week, after the initial exposure to the virus, then they get the mild illness, like we saw in the question stem. So we'll see that mild fever and just mild cold-like or upper respiratory symptoms. And then after a while, we'll see a rash appear. And so after this cold, after a week, we'll see a rash come, and then we have this classic appearance, right? So then we get this classic rash, but this rash, this slap cheek appearance, disappears after 2 to 4 days. And then after that, the patient can have rash on their extremities intermittently, so it'll come and go for the next few weeks. But in reality, this illness is really self-limiting, which just means that you really don't have to do anything. You just do supportive care, and then the illness will go away on its own. And the problem with this illness is, if a pregnant woman gets this, the virus can go and affect the growing baby, right, and the growing fetus. And so in this case, you can end up having heart failure. And so what happens is you have hemolysis of the virus can go into the fetus's bloodstream and cause hemolysis of the red blood cells, and then that causes heart failure. And so that leads to edema. And so talking about this a little bit more, so you might remember this from your circulatory unit or module. And so essentially you have your mean arterial pressure, which equals your cardiac output times your your systemic vascular resistance, which is all your vessels in your periphery. And so when they close down, the resistance goes up. So this part of the equation will go up. And so cardiac output can be separated into heart rate and then stroke volume. So what happens is, if you have hemolysis, so the virus causes hemolysis of the fetus's red blood cells, that's going to be a problem, right? So red blood cells transfer oxygen. And so if now you don't have enough oxygen in your periphery, the only thing your body can do really is increase your heart rate, because without enough oxygen, you need that cardiac output to increase. And so the only way to do that is to increase heart rate. But that's obviously a problem, because now you're putting a lot of strain on the heart. And so eventually the heart's going to wear out just because you're putting so much pressure on it, and that's going to cause heart failure. And so causing heart failure in the growing fetus is going to cause the blood flow to congest and back up because the heart's failing. And then the longer the heart's failing, the more likely that the vessels go under stress, and then the fluid can start leaking into the interstitial tissue, and that causes diffuse edema of the fetus, and that's why it's called hydrops fetalis. And it is a fatal condition, and so that's why we try to prevent pregnant mothers from getting this in the first place, because it's dangerous to the child. And so talking a little bit more about the other option choices, so we have rheumatic fever for another one. So this one is actually caused by group A strep, which would be strep pyogenes. So rheumatic fever actually occurs after scarlet fever. And so the thing about rheumatic fever is you need to have these 5, not necessarily all 5 of these, but at least some of these symptoms to be able to diagnose this. And this patient did not have any of these. And so you have to have joints. So strep pyogenes can cause joint pain, and then it can also cause endocarditis. It can cause subcutaneous nodules, erythema marginatum, and then syndrome chorea, which is a neurological disorder which can cause chorea, which is uncontrollable movements. And so in this patient, we didn't see that, and so that's why it's not going to be rheumatic fever. And so moving on to the next one, we have congenital deafness, which was another answer choice. So in this case, if you get rubella, which is otherwise known as German measles, and I'll explain why it's called that in a second. If you get it in pregnancy, what can happen is you develop a rash on the face, and then it spreads downwards. Now, if you remember, for normal measles, so rubella is also called German measles, but normal measles also has a rash on the face. And I'll talk about how to distinguish them in just a little bit. And so for rubella, so you have a rash on the face that spreads down. The other symptoms are going to be fever, post-auricular lymphadenopathy. Post-auricular just means behind the ear. Auricular means ear. And then pain in your joints. So, and then if a neonate gets it, the difference between a neonate and a adult getting it, one difference is the pain in the joints. The other thing is, if a neonate is born with it, you typically have a few different problems. So the classic triad is going to be cataracts, deafness, and persistent ductus arteriosus. And then they also like having this buzzword of blueberry muffin rash. And so this is the classic triad for developing rubella when you're a neonate. But in real life, I think this is actually pretty rare to get all 3. But it's something to know about, and this is why we try to also prevent pregnant women from getting this as well, because there can be severe birth defects. And so finally, we have measles. So this is kind of confusing, because this is called rubeola. And so remember, the other one is rubella, and this is rubeola. And so this is measles, and why this is similar is because you have the red rash starting on the head and moving down. The difference between this one and the previous one is that you have the classic 3 C's, which is cough, coryza, which is tearing from the eye, and then finally conjunctivitis. And then the other one is going to be Koplik spots, which are going to have blue spots in the mouth. And the complication with this is after a few years, the infant can develop SSPE, which is subsclerosing panencephalitis, so a really dangerous infection of the central nervous system. And so to answer this question, you had to recognize that this was parvovirus B19, with this being a young child coming in with the classic rash on their face, having a prodrome 1 week ago with the mild cold and fever, and then otherwise being pretty well appearing. And so the second part is understanding the complications of parvovirus. So one of them can definitely be hydrops fetalis, and I explained the pathophysiology of why hydrops fetalis occurs, so that can help you cement that knowledge for the future. So I hope that helped, and thanks for watching.